Hi, this is Dr. Stephen Katz, owner of the alternative medical clinic based in Scottsdale, Arizona called Naturopathic Physicians Group. I co-host Your Health is Wealth. I hope you enjoy this informative natural medicine podcast and listen weekly for the newest installment. You can learn more about us at naturopathicgroup.com.
Welcome to Your Health is Wealth, giving you the keys to unlocking better health naturally. Today, you'll learn about how to bank wisdom for a fuller, richer life. Your hosts are Dr. Stephen Katz, an award-winning naturopathic doctor and former president of the Arizona Naturopathic Medical Association. Also, Dr. Loreena Ryder, naturopathic doctor and current board member of the Arizona Naturopathic Medical Association.
Welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside with my co-host, Dr. Loreena Ryder. We are licensed naturopathic physicians, and our office is located at Naturopathic Physicians Group in Scottsdale, Arizona. We're here to help you navigate your journey to wellness, but we like to do it simply without using all the confusing medical terminology that everybody hates. We are here to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. Every single week, we like to tell everybody, what is a naturopathic doctor?
Hi, I'm Dr. Loreena Ryder, and I'll talk a little bit about naturopathic doctors. We provide primary care and specialized care. We look at the body as a whole. We determine the root cause of your symptoms, and then we treat the cause rather than treating just your symptoms. Our office visits look a little different than a traditional medical doctor's office visit. We see you for 1 hour, and that's the initial appointment, and we ask many, many questions, so we do a thorough intake. And we believe that prevention is the best form of cure. We want you to get better and stay better, and we want to improve your quality of life.
When you say that our office visits are a little different than traditional, that's the biggest understatement ever.
It really is.
We spend a lot of time with the patients. It's not 3 minutes, 5 minutes. It's a full intake. We do the full history. We get you on your right path.
And I find my patients actually enjoy their visit. They like to come see the doctor. Wouldn't you agree?
Till I bring the needles out.
Yeah, right.
They're usually happy until then. So today, our topic of the day, every week we do a different topic. And this week, due to a request, we are doing liver health. And we're not talking about the liver that you eat at your barbecue place. We're talking about the liver, the organ.
We all have a liver, hopefully. Can't live without your liver,
Can't
right?
live without your liver. The liver is a major detox organ. It's located at the right lower portion of your rib cage, or you can say upper right area of your abdomen. And it's basically the size of, you put both your hands together, it's pretty much that size. If it's bigger than that, you might want to get that checked out. But it has a lot of blood vessels that run through it. So it does a lot of processing in our bodies.
Mm-hmm. Yeah, so your liver is responsible for processing things like hormones, medications that you're taking, cholesterol within your body, glucose or sugar to produce energy and store energy for later. It also processes iron, and it's responsible for blood clotting, bilirubin, and just many, many, many other things. I think the liver is responsible for at least 500 different reactions within the body.
So you pretty much just said everything that our body has to do, which is another reason why you can't live without your liver. If you don't have a liver, you're done.
You're done.
It's a factory. It produces proteins. It helps your immune system. It helps with nutrient absorption with the food we eat. It also helps break down food using something called bile to break down food, and helps with digestion. So every aspect of our body, the liver has a big, big proponent with it.
Mm-hmm. Yeah. So going back to cholesterol, our liver produces approximately 80% of our cholesterol in our body. And that isn't a bad thing. I know as soon as you say the word cholesterol, people think, oh, that's bad, right? Evil cholesterol. But our bodies need cholesterol for many things. Hormones, for example, they are built from cholesterol. If you have low cholesterol, then you don't have as many hormones floating around in your body.
It's a big reason why one of the common side effects of anti-cholesterol meds is low testosterone, low sex hormones, fatigue. All of those are made through your adrenals, and cholesterol starts the adrenal process.
That's right.
So without cholesterol, everything your adrenals does goes way, way down.
That's right. Yeah. Now, too much cholesterol obviously is a bad thing, but so is too little. We need to have a balance in everything in life.
And the liver is a storage. It stores a lot of things, including vitamins that we need to survive. Vitamin A, vitamin D, E, K, every other ABC you can think of. Not really. There's a lot of different Bs. B12. But it stores in the liver, and it actually helps make and create certain or store certain amino acids which are needed for brain health, muscle building. It's needed to actually convert those vitamins into the active forms. And what that means is when you eat your vitamins through food or through supplementation, the body oftentimes has to take that vitamin and break it down to the active state in order to do the process.
Yeah.
The liver helps do a lot of those conversions.
Yeah, the liver is amazing. And we've only talked about a few things so far, but I'm impressed with the liver. It's almost bionic. It also acts as a filter. So it captures harmful bacteria that might be floating around in our blood system. It clears those pathogens. It's extremely an important detox organ for our bodies. And it's just one of the many ways that we detox. But it's, I would say, one of the most important ways.
And if your liver is sluggish, because it's a detox organ, if your liver is sluggish, the way I explain it to patients is if you're exposed to a toxin, say 2 toxins every single day, and your body can only filter 1 toxin every day, say the liver is sluggish and not doing its job, that means every single day you now add 1 to the total toxic burden in your body. So after a week, you're at 7, no big deal. After a year, you're at 365. After a decade, 3,650. That's how we get these big toxic burdens in our body where our bodies can't detox, and then you get all of the diseases associated with it.
Yeah, that's a good way to look at it. Your liver also creates urea. Urea is the main component of urine. And so the way we eliminate urine is another way to detox. So it's that detox mechanism going on there. And you need to make sure that you're detoxing properly, so drinking enough water to get rid of that.
And as long as you don't wait to the last minute to help heal your liver, the liver can actually be very restorative. It actually can heal a lot on its own if you're given the right tools. It's really kind of just a very impressive function in our body. It does everything. But today, during our episode, we are going to go over all of the problems that can happen with a non-functioning liver. And also, we're going to go over all of the ways to help fix it.
Mm-hmm. Yeah. So as I mentioned before, your liver is amazing. It is incredible. It performs over 500 functions in your body. I mean, if I had a favorite organ, I might say it's the liver.
It's a pretty good one. But in general, though, we're going to talk about a lot of different conditions, and we're going to talk about all of the treatments and labs we're going to be able to do.
Mm-hmm. Yep. So thanks for tuning in to Your Health is Wealth. We're Dr. Stephen Katz and Loreena Ryder from Naturopathic Physicians Group. We're located at Scottsdale, Arizona. On our show, we provide practical information so that you can take charge of your health and help get your life back. Today's topic, thanks to a patient request, is liver.
So every week I do a segment called What Isn't Your Doctor Telling You? I say every week, this is not an anti-doctor segment. It's just when you have your very short, brief visit with your conventional doctor, there's no way they can go through everything you need to know about your health. So I like to give a tidbit every single week that you might not have thought about before. So since this week's topic is on liver, I wanted to talk about how the liver converts excess sugar into fat. So therefore, if your diet is high in sugar, which is about 70% of this country, if your diet is high in sugar, it's not only going to create inflammation in your body, but it's also going to create more fat in your liver. Therefore, increases your risk for a condition called chronic fatty liver. Chronic fatty liver is probably the most common liver disease out there, and one of the main causes of it is sugar. So when you have fatty liver, because as we talked about earlier, your liver is a big detox organ. Therefore, it will actually slow the detox capabilities of our body. Therefore, when you have more toxins floating around your body, increases your risk on autoimmune conditions, inflammatory conditions, neurological conditions, obesity, etc. So sugar and the liver, not a friend.
Yeah, so if you have someone if you have non-alcoholic fatty liver disease and you're thinking, I don't eat sugar, it could be that sugar is coming from carbohydrates that you're eating that turns into glucose into the body, and the body sees that as the same thing.
So the first thing we're going to do is we're going to talk about just the common symptoms that are associated with liver conditions. There's a lot of different liver conditions out there, but the symptoms oftentimes have very similar looks to each other. The first and most common symptom people start to get during an acute liver issue is going to be upper right abdominal pain. So upper right. Now, it can be felt in other areas in the abdomen, but the tell is generally in the upper right area.
Yeah, right under the rib cage area, because the rib cage acts as a protective bony structure for your liver. And then if you have yellowing of the skin or eyes, and you might not notice this yourself, but your friends or your family will definitely notice this. If they say you're yellow, you look yellow, you're turning yellow, that means your body is unable or having a difficult time clearing the bilirubin from your system, and you should get to a doctor or a hospital right away.
In the movies, they show people that it's known as jaundice. In the movies, they make it look so fluorescently bright yellow that it looks like it's so obvious to see. But most of the time when people get this, it's not that obvious. It might be just a subtle little yellowing in the eyes, and they could be early stage of liver issues or late stage and don't even know it.
That's right. Yeah. It's not going to be that like on Willy Wonka and the Chocolate Factory when Violet turns violet. Do you remember that scene?
I do.
It's not going to be that obvious.
Blueberry.
Yeah. Another symptom that you might notice with your liver being...
What about the Oompa Loompas? What did they have?
Oh, they might have had jaundice.
I don't know. They were a lot of different colors.
So if you're noticing fatigue, that might be another liver-associated symptom, and also any nausea or vomiting could be associated with liver as well.
Swelling is a very common thing with liver, and especially as it becomes later and later stages. But if you get swelling in the arms and legs where it just feels like there's fluid in there, that can actually be a sign that you have liver disease.
Right. The medical term for that is called ascites, and it's pretty evident whenever you get a physical exam. You'll find that it's sloshy almost
in the stomach.
Mm-hmm.
Yeah, that's when you start getting it in the abdomen, that fluid. That's the ascites.
Right. Yeah. Itchy skin is something that is related to liver. That's a buildup of the bilirubin as well, that you're not clearing that properly. And also if you have dark urine, that's an indication that you're spilling out some sort of bilirubin that's coming from the liver into your urine.
Loss of appetite's another one a lot of people will get as well. But those are the most common symptoms people get with liver disease. Mm-hmm. Now, when you talk about conditions, the most common condition people get with liver disease, as I was saying in the What Isn't Your Doctor Telling You segment, is non-alcoholic fatty liver disease. Non-alcoholic means there's also a term for fatty liver called alcoholic fatty liver disease. These are two of the most common conditions that people get with liver conditions.
Mm-hmm. So the non-alcoholic fatty liver disease, you had talked about that a little bit prior. That's coming from eating a diet that is high in refined, very highly processed foods. So most of the time these foods are coming in boxes. They sit on the shelf and they rarely have a soon expiration date, and they're going to turn to sugar in your bloodstream after you eat them.
And about 80% of the grocery store has added sugar in the food, even if there's no reason to add that sugar in there other than make you addicted to it.
That is correct. And then the alcohol-induced fatty liver disease, well, that's what it sounds like. That comes from drinking alcohol. And the sugar content in the alcohol as a whole inflames the liver and then ultimately down the road leads to cirrhosis.
And early drinking leads to later drinking for people. Pretty common from that standpoint. So the earlier you start drinking, the faster your body can actually turn into a cirrhotic liver. But basically, cirrhosis is chronic liver damage, but the most common cause of that is going to be from alcohol. But basically, it's scarring on your liver. Your liver becomes like scar tissue, and it leads to liver failure.
When you say early drinking, are you talking like early in the day or early in your life?
Well, if you're drinking early in the day, you're probably on the right track for alcohol liver issues as well. But I'm talking about teenagers when they're drinking before they're legally supposed to drink, which...
If you're a teenager, that's before you're legally supposed to drink. Yep.
Correct.
Right.
But they do. We've all been in high school before. I'm not admitting to my faults. I did not do that ever.
No, I believe you.
Did not. Not to the day I turned 21. And only one day, never drank after that.
I was just clarifying. So it's early in your life.
Yeah, the earlier you start, the more likely you're going to start putting toxins into the liver and start causing damage in the liver. But I've met 50-year-olds that have cirrhotic liver. They've drank and drank and drank and ate horribly too, and they've created damaged liver. Mm-hmm. Once it's cirrhotic, there's not a lot you can do. You can slow the spread, but ultimately your liver's dying.
Right. And with the liver being so regenerative as it is, I mean, it can take a beating, but it has a point of no return as well. So there are hepatitis A, B, and C. So we'll just talk quickly about those. These are also liver diseases. Hepatitis A is pretty common. It's food and water spread, and it's typically either a daycare spread situation or even maybe a retirement home, anywhere where there are diapers. So you can also, if someone touches the feces of a person who is infected with hepatitis A and then accidentally ingests that later somehow, didn't wash their hands or whatnot, you can get hepatitis A.
And for all you raw food lovers out there.
Oh, boy. Yeah.
Definitely linked to that as well. Yeah. Not saying you can ever do that, but understand it does increase your risk. And on the bottom of all those menus, it always says eating raw food or undercooked food increases your risk for a boatload of things, and one of those things can be Hep A.
That's right. And typically people get better without even any treatment on hepatitis A, and you might not even know that you have had it.
But on the other hand, there is a rare amount of cases out there, but it does happen to where Hep A can turn into a long-term infection and become damaging to the liver.
Mm-hmm. Hepatitis B is a little more well-known. This is transmitted by sexually transmitted factors and then also, any bodily fluids. Hepatitis B is viral, so it can cause short-term or long-term infection. And people usually get better on their own without some treatment, but some people do end up having a chronic hepatitis B situation.
And as long as your body tolerated, there is a vaccine for Hep B. And as long as you don't have any problems when you receive that vaccine, it's almost 100% effective. If you had the Hep B vaccine, not advocating getting STDs or playing with bodily fluids, of course, but if you've had the Hep B vaccine, you largely are unlikely to ever get this.
Good information. So there's also a hepatitis C, and this is sexually transmitted disease as well. Now, this is blood to blood rather than bodily fluids. So a little harder to catch, but it's just a different mechanism of catching it. So the acute is going to be, the short-term infection. These symptoms can last up to 6 months, and they're going to be the same liver symptoms that we talked about earlier. Sometimes your body is able to fight off this infection and the virus goes away, but for most people, an acute infection leads to a chronic or a long-term infection.
Now, they've come a long way when it comes to treatments for this as well, as they actually have a couple drugs out there. Now, there's a lot of side effects to these drugs, so not everybody does these drugs and gets better, but there are actually drugs out there that have an over 90-something% cure rate. So this isn't such a bad, it's not good, you don't want it, of course, but it's definitely come a long way when it comes to treatments. This was a really scary time condition around the HIV scares as well, because they were doing blood transfusions without actually testing people. So there was a lot of people that had blood transfusions in the late 80s, early 90s that were actually given Hep C.
How unfortunate.
And those medications are called Epclusa and Harvoni, but they're definitely medications that have come a long way, but they do have a lot of side effects with it as well. So thanks again for tuning into our show, Your Health is Wealth. We are Dr. Stephen Katz and Dr. Loreena Ryder, licensed naturopathic physicians. If you continue to feel like your health is more of a struggle and not an afterthought, we're here to help you regain control of your health. Our office is located at Naturopathic Physicians Group at 9200 East Rain Tree in Scottsdale, and you can reach us at 480-451-6161. We are talking today about our liver and how natural treatments can be used to improve your liver function. We take the song Mission Impossible every single week because our patients tell us that they've been through the journey in circles of trying to find the doctor to help cure them. And we like to take that impossible mission and make it possible.
Yes, we do. Today we're talking about the liver, and I like to give a tip of the week every week so that you can take this information, use it at home, and hopefully improve your health for yourself. So I would like to talk about castor oil this week. And I do not want you to drink castor oil because I know that's an old remedy for getting labor going in pregnant women, but I want you to use the castor oil topically because I don't want you to be sitting on the toilet from drinking it. That would be bad. Or having a baby. So
that's bad too.
That is, yeah, especially if you're not pregnant. So whenever you think that, well, I think everybody needs this. I think everybody could use a liver detox, and your liver does so much work. Why not just help it out anyway? So what you would do is just buy some plain old castor oil from the grocery store. And there are two ways to do this. You can do it the quick and easy way, which I prefer and most people prefer, or you can do what I like to call the Cadillac version, which has a whole lot more involved. But put some castor oil in the palm of your hand, rub it directly on your skin where the liver is. So that's at the lower right side of your rib cage, just directly on the skin. Throw an old t-shirt on, put maybe a towel down on your bed, go to sleep, and just let that soak in overnight. It's a little sticky, it's a little messy, but really it's not going to hurt anything. So if you want to make it a little more fancy, what you would do is soak a cotton or a wool cloth in the castor oil, place that on your right rib area, put some heat over top of that with maybe a heating pad. Now you'd want to protect, any clothing and blankets or anything you're using, and then leave that on for about 20 minutes while that heat helps the castor oil soak into the body. Now, castor oil is made from a castor seed. It's also called ricin, and it's highly anti-inflammatory. So that's why this is helping. And it also helps detox the body through the lymphatic system. So that's the mechanism of action there.
It's a great, cheap, easy way to detox.
And that is old school naturopathic right there.
Nice. Now, we talked about in the last segment the different conditions. This time we're going to talk about how do you find out, do I have something wrong with my liver? Most of the time, if somebody's going to find out, they don't even necessarily have symptoms yet. So the easy way to do that is when you do your annual physical and your annual labs, your doctor should always run a panel called the CMP, Comprehensive Metabolic Panel. In that panel, it will do a full liver function test. So there's a lot of different tests out there: AST, ALT, GGT, ALP, bilirubin, albumin. So it sounds like there's a lot of different things there, but all of them have a different function in the liver. If there's something wrong in your liver, these will tend to get elevated.
Mm-hmm. Sometimes I get a little sneaky with my patients, and if I suspect that they're having a lot more alcohol than they're really admitting to, I'll purposely run a GGT just to check.
Yeah, we catch them. We catch the liars.
We do.
Now, we talked a lot about alcohol fatty liver disease and non-alcohol fatty liver disease. When those patients have elevated liver enzymes, they tend to be a little bit more than normal, up to about 2 times more than the normal range. They don't usually spike to the super high levels. They can, but it's not usually that way. They tend to be 1 to 2 times the normal range of theirs. So we can usually tell when they've got fatty liver. But they usually come into, they tend to be more overweight, or they tend to tell me, if they're being honest, that they drink all the time, or if they're not being honest, they drink once in a while. But we'll figure that out for sure when we talk about diet, if they're being honest. Now, if there's a hepatitis or late stage liver conditions, liver cancer, stuff like that, those enzymes tend to go through the roof, and they can be 10, 20 times the normal range when that happens.
Yeah, and I found if it's kind of in between that 2 times and that higher spike, it could be that you're getting over some sort of a viral infection, something like maybe an Epstein-Barr, or just maybe some sort of virus that's unidentifiable that you've gotten sick from.
And when it's that high, it doesn't mean that fear the worst either, because it can be just the virus like you're talking about. But it is still something to get checked out to make sure.
Absolutely. Yeah, you can also, take a look at what your liver actually looks like by doing an abdominal ultrasound. This is something that your doctor can order. It is first-line imaging for when it comes to liver issues. You can do a CT scan. You could even go deeper and do an MRI if you needed to look a little further into the structures there. And also, if you definitely need a biopsy to find out if there's maybe a questionable lesion or something in there, you can get that done as well. This looks for signs of damage and scarring, maybe even a tumor that might be living in your liver. Another specialized type of ultrasound is called a fibroscan, and that can measure the degree of scarring and fat deposition that's in the liver.
How fatty your liver actually is when you would do a fibroscan. So it kind of tells you later stage or not if you have a really bad fatty liver case. But as you were saying too, when you're doing the scans and you're looking for the stuff, if you have any abdominal pain issues and you're not sure what's causing it, that abdominal ultrasound is a really good test. Doesn't have all of the radiation that some of the other tests do, and they can take a look at your entire abdomen and determine, is it gallbladder, is it liver, intestines. So they can actually take a look, kidneys. They can look at a lot of different things through that abdominal ultrasound, and it's usually pretty inexpensive.
Yeah, I love whenever we advance in medicine and can do cool stuff like that. Well, plain old physical exam is a really good way to check your liver. If somebody's having pain, all you have to do is palpate it, and that just means feel the area. There's different ways that you can get up under the rib cage and feel the liver. Does it cause pain in that patient? That's an indication that something is wrong. There's also a way that we can measure it. And there's a normal range for where your liver is supposed to be. You can do, tapping to make sure that it isn't going too far north of the rib cage, because you can't really get in there and measure other than that way.
Yeah, there's not a lot of fancy testing that has to go along with checking your liver. It's pretty standard checks on most exams, but you need to still do these basic physical exam, blood work, scan if necessary, but those are really the main things that you would do for that. On the other hand, though, if you are taking certain medications that can cause liver damage, you may want to check your liver enzymes and do your exam more frequently. And sometimes the doctor will tell you need to do it every so often because you're taking these, because you don't want to get liver disease, because oftentimes when you start having symptoms that we talked about already, you're already pretty later stage and you don't want that.
Mm-hmm. Yeah, so it's a really great idea to do the liver tests as routine labs, maybe once a year. I think that's a good thing, unless you're looking for something specific, and then maybe twice a year. But it helps diagnose liver diseases such as the hepatitis A, B, and C that we talked about, and alcoholism, liver cancer, nobody wants that, and diabetes as well.
Yeah, and the medications, again, the most common medications that are linked to liver issues and sometimes even liver failure, Tylenol, biggest common one that everybody has over the counter. Certain antibiotics are linked to it. Medications for gout like allopurinol, and another very common one people never think about are those statin drugs. We talked about how important cholesterol is earlier, but those statin drugs actually are linked to liver conditions.
Unfortunate, there's so many people on a statin drug.
Some arthritis meds, some antipsychotic meds, painkillers like diclofenac, which is an NSAID, and there's 100 other ones.
Mm-hmm. Yeah. If you feel like you're just not getting to the bottom of your health issues with your current doctor, it's time to call Naturopathic Physicians Group. Our office is located in Scottsdale, Arizona. Our doctors are well versed in all aspects of healthcare and are ready to help you gain your health back. Thanks again for tuning into Your Health is Wealth. We're doctors Loreena Ryder and Stephen Katz. Today we're talking about your liver health.
So this whole segment, we're going to do nothing but talk about treatments and treatment options you can do both at the office as well as at home. The liver, we've said it time and time again, it's a detox organ. You have to support your body's natural detoxes. We had a whole episode on water and oxygen, on how it allows the body to flow toxins out. So you have to drink water in order to get that junk out. It's something so simple, and yet so few people drink enough water. So the rule of thumb really is drink at least half your ideal body weight in ounces per day. We said ideal body weight. If you are a 400-pound person, yet you want to lose weight, what's your ideal weight? That's the amount of water you want to drink. Half of that. Half of your ideal weight.
Yes, that's correct. I mean, the liver is a detox organ. So what we want to do here to treat that is to help the other detox pathways in order to reduce the load on the liver. So water being one of those, sleep is another detox pathway. I know people don't really think about that when it comes to sleep, but our bodies regenerate and clean house while we sleep. So it's extremely important to not only get a good quantity of sleep, but also get a good quality of sleep. So whatever measures you need to take, and that could be an entirely other segment on sleep, and maybe we'll do that one day, but whatever you need to do to get that good sleep for you and the right amount of sleep. It's not the same for everybody, right? So some people are okay with 7 hours, some 9, and a few people can even survive on 5 or 6 and still function normally.
As we talked about when we talked about digestion a few weeks ago, our body goes through digestion in 80% of our immune systems in the digestive tract. So if you are not sleeping well and your body goes through digestion when you sleep, you're not getting enough of that healing capabilities. Mm-hmm. Gallstones, a lot of people have gallbladder disease out there. And if you're forming gallstones can actually lodge into the duct and actually block the liver and cause liver damage. So it might be a gallbladder issue that leads to liver damage. Number one reason someone's going to get gallstones, poor diet. You have to eat clean. Your bowel movements, your healthy eating has to be working properly. If you're one of those people that does not have a bowel movement every single day, I said every single day,
important.
You are not detoxing properly, and you have a higher risk of causing liver damage. Mm-hmm. You have to be able to eliminate the waste. And I have patients all the time say, "Oh, I'm regular. How often do you go?" I don't know, 3 times a week, but it's regular. Like, no, that's not regular. It's regular for you, but that's not actually regular.
Well, think about it. If you're putting food into your body, it should also be leaving your body at a similar rate. So if you eat twice a day, an ideal pooping time would be twice a day, right?
Yeah. Believe it or not, 3 is even better than 2.
Right.
You have to poop every day. Mm-hmm. We love talking about poop every week because it's so healing. It's a detox.
It is. It's one of the detox pathways. Another detox pathway is sweating. And it's an elimination. You know, it eliminates the toxins out of your body. Now, I know that sweating isn't popular when it comes to teenagers. They're embarrassed. They don't really want to sweat. But it's an important function of the body to get those toxins out. So get plenty of exercise, sweat-inducing exercise. I'm not talking about a stroll in the park. I'm talking about get pink in the face, get that sweat going, but also drink enough water to produce maybe a light yellow or clear urine, because you want to make sure you're staying hydrated. So dark urine is a problem too. So whether you have liver issues already or you're just severely dehydrated, you might not be eliminating as much waste as you should be. You can try an infrared sauna. And
don't rob Peter to pay Paul. Don't do all these detox things and then drink a bunch of alcohol, eat a bunch of sugar. We hear this as well all the time. We'll have, well, I allow myself to cheat on my diet because I'm just going to go run on the treadmill and burn all those calories. It doesn't work. If you want to actually heal and feel your best, you can't rob Peter to pay Paul.
Yeah, I mean, some people will try to like add an extra glass of water in if they've had alcohol or whatever. That's better. It's better, but you're right. So the infrared saunas, they'll eliminate toxins at a higher rate. The infrared is better than just a traditional sauna. It also supports the liver and the rest of the body as well. And your exercise, I think 5 days a week is good. 30 minutes a day at least. That can help reverse and remove fatty liver for sure. And it increases energy and gives you, takes away that fatigue, gives you oxygen flow. That's also good.
When we had our whole episode, we talked about oxygen and ozone therapy, and we discussed exercise in that time. The more you exercise, the more you increase your oxygen flow, and that oxygen flow will increase to all of your vital organs, including the liver, and make it way more efficient to detox.
Right. So yeah, we really want to support the detox pathways. And so there are other organs that detox as well: the skin, the lungs, the kidneys, and we just talked about the colon getting rid of bowel movements, and the kidneys would be getting rid of urine. But the skin is an organ.
Skin is a big organ. It's the biggest one. In fact, a good test to see how toxic you are is if you do have a sauna or you just want to go to do a sweat, is you sit in something that will make you sweat and put a white, clean towel under you. Do that sweat, and then look at your towel when you're done. It is a shocking moment to a lot, especially if you're like a smoker or you're a big chemical user, and that includes people that wear tons of makeup, use all those horrible shampoos, conditioners, all those chemicals that get in your body through your skin. When you actually do this test and you look at your towel, it can be yellow, it can be black, it can be all these sorts of gross colors in there. All that crap came out of your body.
I'm going to do it.
Do it.
I'll report back.
Scary. Now, if you see Skittle colors, then there's another problem.
I won't report back if I see Skittle colors.
Rainbow.
Yeah. So IV therapy is another really, really great way to support your liver. It's something that we love to do at Naturopathic Physicians Group. One of our most popular IV therapies is the Myers cocktail. So that has mostly vitamin C in it and many other nutrients and vitamins in there. And then we follow it up with a glutathione, which is really great antioxidant for the detox pathways.
It's probably the fastest way you can actually detox out of your body is with an IV, because you can bypass the digestive tract. You put those nutrients right in, and glutathione is a major antioxidant that gets right to the liver and helps detox. It's also good for your brain. It's good for your lungs. It thins out mucus. It just does a lot of really good work.
Mm-hmm. I love my Myers. I try to do one a month at least.
There's lots of supplements out there, liver support. The most famous one is probably milk thistle. It's been around for 2,000 years or more. It's been around longer than that, but it's been used for over 2,000 years. Major antioxidant, decreases liver inflammation. It's even been shown to slow the progression of damaged liver. So it helps with longevity for anybody who is in that later stage and has cirrhosis.
Mm-hmm. Yeah, milk thistle is fantastic. I think those are the jaggy bushes that I used to tramp on in Pennsylvania as a kid in my bare feet. Also, dandelion, speaking of running around in my bare feet, dandelion grows wild in Pennsylvania, but it's a really, really great liver detox and liver support. It helps produce bile. So you can actually, if you live in the Northeast, you can pick it and make some salad out of it, or also, some tea.
Burdock root, red clover, ginseng. Those three have also had studies that actually show it decreases those damaging liver or those liver enzymes that are elevated when you have damaged liver. So those three as well can be very helpful. And again, when we tell people about these supplements, we don't want you running to the store and buying them. We always dose them accordingly based on our patient's needs. Everybody's a different case.
Mm-hmm. Yeah. Green tea is another anti-inflammatory and liver support. It lowers those liver functions, the tests that we were talking about, the ALT and the AST, and it helps with non-alcoholic fatty liver disease. Now, you can do hot green tea. You can do chilled green tea. Just make sure that it doesn't have a bunch of sugar loading it down, because that gets rid of the healing quality.
And our favorite one is probably turmeric. It's been used forever. It's great for your brain. It's great for liver. It's great for cardio. It's great for everything. So thank you for tuning in to Your Health is Wealth. Next week, we will be talking about another great topic, and we hope you can join us.
Thanks for listening to Your Health is Wealth. Be sure to tune in next week to learn more wisdom on how to live a fuller, richer life. If you have questions about today's show or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161.